is Chelsea Wingard, and today I'm going to be speaking to you about strokes. Imagine you get hurt and you have to go to the emergency room. When you get there, the nurse takes your weight, your blood pressure, and your past medical history. As she leads you back to your room, you hear over the intercom, "Stroke alert in G-Pod, room G73, stroke alert in G-Pod, room G73. Once you get to your room, she asks you to calmly wait and wait for the doctor. As you sit there, you peer out into the hallway, and you see every available nurse running down the hall towards G-Pod, pushing a crash cart. As you sit there, you may ask yourself, what is a stroke? How do they even know that the patient was having a stroke? And what are the common symptoms of a stroke? According to the National Stroke Association, every year nearly 800,000 people are affected by strokes or recurrent strokes. Stroke is actually the 5th leading cause of death in the U.S., and interestingly enough, up to 80% of strokes can actually be prevented. Today, I'm going to explain to you what a stroke is, what the common symptoms of a stroke are, and how you can save someone's life by acting fast. Let me start by explaining to you what a stroke actually is. A stroke is caused when there is a lack of blood flow to a certain area of the brain. When the brain is deprived of oxygen, parts of the brain begin to die. When that occurs, certain areas of the body are affected due to brain death. You may experience a loss of fine and gross motor skills, along with facial droop, slurred speech, or even a loss of speech. Strokes are caused by 2 different types of complications. The first is a hemorrhagic stroke. This occurs when a brain aneurysm in the brain bursts or a weakened blood vessel leaks. This type of stroke typically leads to death. The second type of stroke is an ischemic stroke. This occurs when a blood vessel carrying blood to the brain is clogged by a blood clot. This is the most common of the 2 types of strokes. Now that you have a basic understanding of what a stroke actually is, I'm going to inform you about some of the symptoms. If someone is feeling sudden weakness or tingling in either their arm or their leg, typically on one side of the body, they may be experiencing a stroke. They may also have confusion, trouble seeing in one or both eyes, trouble speaking, and a lack of understanding. They may also experience dizziness, trouble walking, lack of coordination, and a severe headache with an unknown cause. Now that we have identified what a stroke is and what some of the symptoms are, I'm going to inform you how you can act fast and how you can actually save someone's life. F stands for face. Ask the person to smile. Are they able to smile at you, or do you notice that they are experiencing some facial droop? A stands for arms. Ask the person to raise their arms. Are they able to hold their arms out in front of them, or do you notice one side seems weaker? S stands for speech. Ask the person to repeat back to you a simple phrase. If they're able to repeat it back to you, is their speech normal or is it slurred? If they are not able to repeat it back to you, are they experiencing some confusion? T is the most important of them all. T stands for time. If someone is experiencing any of these symptoms, call 911 immediately. Note the time any of these symptoms started or became evident to you. Time is a huge factor when it comes to treating a person with stroke. According to the National Stroke Association, for every minute the brain is deprived of oxygen, 1.9 million neurons in the brain die. And as I stated earlier, when there is any type of brain death, the patient may experience a loss of movement, memory, speech, or even have slurred speech. Strokes can be unpredictable. They can happen to any one of us at any time. Today, I focused on what a stroke is, what the most common symptoms of a stroke are, and how you can possibly save someone's life by acting fast. Now that you have this knowledge, use the tools that I have taught you today to act fast. If you do that, you may be able to save someone's life. Thank you for listening to me today.